part of our strategy is really about who do we partner with to bring along with us if they're new to the space, but also who is already in this space that we can come behind and support. And so I think as we continue to develop our strategic plan, as we continue to develop our goals, partnership in investing is really, a big part of what we do, but also making sure as a system that we're making both the financial and human capacity and human capital commitment to make sure that our communities are well served by Bon Secours Mercy Health, and that we're supporting projects that not just improve quality of life for our patients, but also the communities that we serve. And so that longitudinal view, the stumbling blocks, the successes, the challenges, all of that is really going into creating our present day strategic plan and how we want to move forward in the space.
As a health system, we take our anchor institution role very seriously as well. And that we see that not only are we one of the largest employers in the region, but that we are also an investor. We're also a purchaser of services. And so we look for opportunities on a continuous basis to figure out how to support the overall economy. But also from a healthcare perspective, that we contribute much more than great quality and safe care for individuals who come here, but we're also giving back to the economy. The role of community investment really is embedded in our strategic plan for the future. What we see is important, again, is not only the need to ensure that we are focused on providing safe, quality care for all who seek services within our health system, but we also think it's important that we understand very clearly what our role is as a community partner, that we take very seriously the workforce that supports us. It's our number one asset, is the people that work here who give back to our community.
We've really taken this holistic approach and said it's not only about the dollars and resource that we're able to invest in the infrastructure of a community. We're really kind of committed to also looking at our vendor strategies and what does our supply chain look like? And so we've really committed ourselves to diversifying our vendor base to make sure that we're hiring local vendors and creating opportunity for local businesses to build capacity to be part of our supply chain conversation. Similarly, we're also looking at our workforce strategy and making sure that, the zip codes around our facilities are well represented, that folks that are interested and able and willing to come work with us have the opportunity to do that. So I think for us, that housing investment piece has really just broadened to encompass to say, we can't just think about one piece of this at a time, right? So the more that we can impact community as place, right, the stronger our community is. Strong communities produce strong individuals. We want those strong individuals to come work with us. We want to create and drive business development. We also want to provide great care to our patients. And if we've really kind of connected and engaged the community in the right way, that some of those folks begin to overlap. So I think it's twofold. So I think one, recognizing that community engagement is not going out into the community, whether that's every 3 years around your CHNA cycle, whether that is you need input for this one project, this one time. That is not authentic community engagement. And I think the number one thing that I learned was that listening is key. When you want to authentically engage community, you have to show up knowing that you've done your homework and you're not walking in as this savior agency that is going to solve all the problems, because more often than not, the community is ready for someone to listen. They've actually done a lot of the hard work. And I think, being able to meet people where they are without an agenda, sometimes it's just attending an event. We may not have a Bon Secours Mercy table. We may not be there to share information. We may not officially be a sponsor, but sometimes it's just showing up. So I think it's, how you authentically enter a space, but I think also preparing to know that this can take a long time. We have residents that tell us 10 years later that they finally understand what it was that Bon Secours Mercy was trying to do when we first entered the neighborhood. Whether it's a housing project and they thought we were just trying to buy up all the houses to tear them down, to now 10 years later, they're like, we finally get it. You've shown us, that you're in it for the long haul. So I think those two things, entering a space authentically and knowing that it does take time. This is not a one-off process. And so not rushing that process too goes a long way to building trust and buy-in for real community engagement.
I agree. Authentic community engagement is critical. It's not just showing up and saying that you were in the room. It's actually sitting at tables with individuals and actively listening and then asking for feedback or opinions or advice, and being true to wanting to hear it and making sure that the information that has been gathered is important enough to influence the decisions. One of the critical lessons that I think our institution has learned is that it is a mistake to walk in to a community setting or a room with a community partner to tell them what you think they need. It is critical to come in and with an open mind and talk about what the common issue is.
And if I may add, I think the other thing that we learn, is that it's not just your forward-facing teams that are engaging community, right? As we think about, the training opportunities, sometimes it's your finance team, and sometimes it's your provider team. And, in our case, it's always our community health team. But what does that mean for the foundation? And, all of these other partners internally that are intersecting with community in any different ways. And so really being able to do that across business lines and across team within the organization is also key. It's definitely a multi-tiered approach. The first measurement was that we were able to make a commitment of a pot of funds that in the long term will always go towards community investment. So for our treasury team, our finance team, it's really about being able to say, we've committed a percentage of our dollars to do this work. And so as we track what that means and how many dollars are available, I think the other thing that we're looking at, whether it's housing and being able to count units, whether it's food and being able to count numbers served, we still want to have those really strong qualitative and quantitative measurements. I think the next step for us, where we still have some work to do, but is so exciting, to your point, long term, how do we measure the social benefit of what we're doing and the social impact, and then couple that with a financial return?
This is a new and challenging area. Because as a health system, it's very easy to look at dashboards and you can see how many admissions you're having or whether or not a performance improvement program changed a quality metric or a quality indicator. But this, as Kendra mentioned, that this is new and we have to think about it in a new way, identify ways to appropriately determine whether or not the investments that you've made are making a difference. Where we haven't had as much traction is identifying opportunities for long-term sustainability of those models, trying to figure out how we utilize some of the new payment reform models to sustain those partnerships, to demonstrate that by investing or co-investing with partners in some of these initiatives that bring together our health system with community-based organizations and public entities to really address social issues, that we are able to say to entities that are underwriting the cost of care or social programs, that this is the way to go in the future because it really does make a sustainable impact on what we're all trying to achieve. Long term, we really need to be thinking about how we measure the overall impact to the populations that we're serving, not just from a healthcare utilization perspective, but from their overall health and well-being, which then gets you into, are we making a difference when it comes to really implementing the goals around health equity? This has been a very difficult year and a half. It's been a time in which there's been a lot of reflection that's gone on within our organization at all levels, and has helped us to really affirm why it is that we're here, our commitment to providing care and services and support to all populations. But I'm so excited that I've seen my team members and colleagues really rise to the occasion. And while our patients may come in with a clinical condition, when they leave, there's many are still facing social conditions that are drivers and that impact the health outcomes that we look at on our dashboards. So it has required that we step back and really think about, what role do we play? How do we lean in just a little bit more and be more intentional in taking a look at our data and developing our programs and thinking about how we interface with our patients? We know that many of our patients come to us and they are faced with many health-related social needs that are driven by the social determinants of health in the communities in which they live.
I think about, acknowledging one, that this is not, the social justice issues are not new, right? So walking into a lens that, again, the community has been fighting and working toward this, for this, with this for a very long time. And so how do we use our platform, our resource, our commitment to our mission to support that work? And that is everything from looking internally, so making sure that our workforce represents the communities that we serve, making sure that we've got a plan for inward mobility, making sure that we are tapping in to the diverse resources that are in our communities. It's really been a reframing of a conversation that we've been having for a long time. But I think being very intentional to be very honest about what it is that we've done well historically and where we have opportunity to improve. What are the expectations that the community has of us as an anchor institution, and how do we set new expectations for ourselves as a ministry? And so I think this time has really been a motivator to say, this can't be business as usual on a lot of fronts, that we really have to, align with community need, evaluate our internal practices and our internal resources, and come out of this more prepared, a better partner, a better listener, a better implementer, to really have that impact.
I think it is important for organizations to be, number one, authentic, but also intentional in their actions. And this intentionality needs to happen at every level in the organization, from the board all the way through to your frontline staff, that it needs to become part of your culture, and it needs to be driven by your mission, that this is a way to actually live your mission in an enhanced way, because we're all here as healthcare systems to provide the best care we can to the communities that we serve. But this takes us to a different level, to really focus on not just the healthcare that's provided inside of our walls, but the commitment to making sure that the communities that we serve are as healthy as they can be. I also think that it gives us an opportunity to think about how to leverage our resources, all of our assets, in a different way, to really show up as not only healthcare providers, but also true members of our community and great stewards of the resources that we have been given to deliver services and to help the people that we serve.
But I think the other thing to remember is that this is living, breathing work. And to be able to really move forward, for many health systems, this is new. For many community-based organizations and community-facing advocates, this is not new. So who are you bringing along with you in your journey? But there's a lot of partnerships that go into this work. And so being also intentional about inviting people or asking to be part of a table where the conversations are already happening. And so really being the partner to others that you would want them to be to you, and making sure that you're not going this alone, because it really does have the ability to be fantastic and to be great if you set your table the right way. And that table is not just a C-suite executive table. That's making sure that you're integrating those grassroots experts, those folks that are living in community and working in community every day, really diversifying that partner table to have real impact.